You've probably heard that SDS is the world market leader in dental ceramic implants, but what really sets them apart? Is it just clever marketing, or do they genuinely offer the best system on the US market? Hi, I am Dr. Tobias Steinherr. I'm a dentist and a specialist for ceramic implants, and I help other dentists successfully integrate ceramic implants into their practices using tried and true methods. In my coaching sessions, when someone wants to get started with ceramic implants, one of the first things we do is to figure out which implant systems best fits their individual needs. To do that, I use 5 main criteria, which I've discussed in a previous video you can watch here, and covered also in detail in my Zirconia Systems Black Book, which you can get absolutely free if you stick around until the end of this video. But for now, let's take a closer look at SDS and their implants and talk about the good, the bad, and the ugly. When it comes to biology, you can immediately see that all of SDS's implants, both the 1 and 2-piece implant, are generally designed as Zirconia implants, aiming to replace the natural tooth as closely as possible. The SDS 1.2 is their 1-piece implant, and the 2.2 is their 2-piece implant. The 0.2 indicates it is the 2nd generation, with some improvements over the first version. The first thing you will notice when looking at the 2-piece implant is that it looks almost identical to the 1-piece implant, except for the missing post in the center. With both versions, the tulip-shaped part should be placed at, or even better, slightly above the gum line, and should be prepared for your final restorations like you would do with a natural tooth. This brings 2 major advantages. First, with both implants, once they're placed and have osseointegrated, the soft tissue can attach to the wider tulip-shaped part of the implant that extends through the gums. This creates a biological barrier between the mouth and the bone and eliminates the need for a second surgical procedure to reopen the gum. Second, because you can prep the implant holder just like you would a natural tooth, you will get a perfect crown margin that's at or slightly below the gum line after healing, which won't interfere with the biological width and creates a natural aesthetic outcome. And another great fact, because of this, there is no need for additional parts like a scan body or an impression post or a laboratory analog. You prep it like a tooth, you scan it like a tooth, and the lab treats it like a tooth. A super smooth workflow with little to no chances for mistakes based on missing parts when it comes to the restoration of the actual implant. This substantial tulip part on the top also plays a significant role in the implant stability. At a core diameter of 3.8, 4.6 or 5.4 millimeters, you have pure zirconia in the crucial neck area. The small hollow space for the post is surrounded by thick zirconia walls and located in the 5 respectively 6 millimeter diameter tulip part of the implant, so there's no risk of fracture under load. The screw connection is another critical part of any 2-piece implant system because it can be a potential weak point over time with continuous loading. Plus, the material of the screw determines whether your system is 100% metal-free, since titanium is often used for screws. SDS offers both PEEK and titanium screws. So first, you have the choice of going 100% metal-free or not, and second, and importantly, unlike other systems, the screw isn't necessary for the post mechanical stability. Since the post is primarily cemented, the screw mainly serves to hold the post in place while the cement sets, so if you skip the screw and prepare the implant shoulder for your final restoration as recommended, you won't lose any overall stability. Here's an important pro tip. You should aim for a circular ferrule of 1 to 1.5 millimeter. If you follow the recommendations, screw losing isn't something you need to worry about. It basically can't happen. This is crucial for the long-term stability of both your implants and your final restorations. With this said, let's move on to simplicity versus variability. In this category, SDS is also very user-friendly. They offer 1 implant body design with a dynamic thread, making them perfect choice for immediate implants, but also suitable for delayed implants, as they're designed to achieve excellent primary stability. They offer 3 lengths, 8, 11, and 14 millimeters, while most other systems offer lengths in 2 millimeter intervals from 8 to 12. SDS's 14 millimeter option is very helpful for many immediate implant cases. With diameters of 3.8, 4.6, and 5.4, and even a small 3.3 diameter for their one-piece implant, there are sizes for every indication and tooth to replace. When it comes to restoring SDS implants, they offer the simplest prosthodontic portfolio on the market, in my opinion. There are two posts available for the two-piece implant, one straight and one with a 15-degree angulation. And as I mentioned earlier, two screws, one in PEEK and the second one in titanium, with the option of actually not using a screw at all. Thanks to their unique design, you basically transform your two-piece implant into a one-piece implant with no difference in stability or biological performance. One highlight is the special cross-sections available for both the 1 and the 2-piece implants with two different oval shapes, the 4.6 oval and the 6x8 oval cross-section. You can mimic various emergence profiles to get as close to the natural tooth profile as possible. If you're a little advanced and more into prosthodontic restorations and aesthetic reconstructions, you could even skip the standard round-shaped implants, except you need a 3.8 millimeter diameter and replace every tooth with one of their oval cross-sections for a superior emergence profile. So to sum everything up, SDS is a system generally designed as a ceramic implant, taking into account the need for high primary stability in immediate implants and in situations with poorer bone quality. The three lengths and diameters, plus the additional small 3.3 diameter with their one-piece implant, along with the simple prosthodontic concept of only two different posts, makes this system both versatile but also very simple and easy to use. If you are aiming for a highly biological system to replace natural teeth for fixed crown and bridge reconstructions, you should consider taking a closer look at the system. But if a big part of your prosthodontic work involves fixing removable dentures with locator systems, for example, there might be other systems that are more versatile and easier to use for that special purpose. But apart from that, SDS is one of the most versatile yet simple systems, well suited for both the beginners and also advanced dentists. If you want to take a closer look at all those details mentioned, not only about SDS but also all the other systems available, you can get my Zirconia Systems Black Book for free. Just follow the link in the description box below and download your personal copy of the Zirconia Systems Black Book. And once you're scrolling down to this description box below this video anyways, don't forget to like and subscribe to this channel, because in the next video we will talk about another system. So stay tuned and never forget, if we can do better, we should do better.